The main reason most of the candidates come to do our extraction course is because they've not learned how to do it in dental school, period. I started noticing something that the students who were going through the programs learned basics, but when they came out, including myself as a specialist prosthodontist, when I finished, I found that there was no hands-on practical experience in teaching students.
I have done some general theoretical courses in Melbourne over the last few years, and while that gives you an understanding of the principles, it doesn't really give you the hands-on confidence.
And so then we came up with this concept where they would go from day 1 to day 5 with a specialist, where patients are picked. There is no, is this the right patient, not the right patient. All the patients are screened. They're screened medically, they're screened dentally, they have cone beam scans, they have study models, and the mentor knows exactly what's going to happen, and they're all simple cases. The course, the way it's designed, is what we call a one-on-one system. And as far as I know, it's not available anywhere else. Every candidate is assigned one mentor. That mentor is completely responsible for that student for 5 days.
It's great that the coordinator actually wants to know what you know and what you don't know after the first day, and then modify that accordingly for, I guess, your education for the rest of the week, and giving you cases that would be suitable for your skill level.
So during the 5 days of the course, from Monday to Friday, the candidates will get to do a minimum of 10 surgical extractions. So I guess candidates need to be aware, this is not a wisdom teeth course alone. It's part of the program. They get to do surgical extractions. Every case, they will cut bone and raise a flap to get a tooth out. But it's a combination of everything. Broken teeth, fractured teeth, impacted teeth, wisdom teeth. So the main reason candidates come to do our course is every day, every week, they refer cases that they would like to have done. They want to be able to help their patients, but also be able to reduce the number of referrals going out where they could safely have done it in clinic.
It's more about improving what I already have, what I already know from the past, and a lot of the difficult cases, like, you don't want to just keep referring them away.
The best part of course is that we go straight into the most critical part. We don't waste time on waiting, on screening patients, on theory study. So we go straight into the hands-on part. That's, I think, why most people want to go for short-term CPD course.
So day 1, when they come for the course, you can see it's like, alright, they're nervous, and it's nervous energy, and that's natural. And I talk to them at the end of the day and say, listen, what you are experiencing is normal. Don't diminish it, use it, and push through it. And so it's a challenge for them. By day 3, I can start to see their face, the demeanor in their face change, and by day 4 is when I actually see them smiling and say, come on, let's get on and let's do this. And then day 5, the mentor literally sometimes just scrubs in and he's just standing on the side. The student says, let me do it.
I think the mentor, my mentor has been really, really helpful. She's very knowledgeable. So even after we finish a case, she would give me all the theoretical knowledge, and yeah, she's amazing. So she's been very helpful when we're doing the case. She would really, really guide me, and so it does not feel intimidating at all.
With getting to India, we've tried to simplify the process. We'll help you and direct you to flights. We have 2 options, or direct you to 2 of the best hotels. There's airport transfers as well, and also transfers from the hotel to the university and back, where I will be with candidates all the time and will guide you through the process. So basically all you have to look out for is your own catering or your food.
Good food, beautiful hotel, nice people, very supportive surgical team, very supportive.
So Australian Dentistry Institute, here we have a social setting or an aspect to it. There's a local orphanage here that looks after 100 odd girls from birth till they get to uni, and they depend 100% on sponsorship. Some of the funding that comes through, we channel it into that or help them out, in a better way of speaking. so that they can provide for the kids and they look after the kids for every aspect, right from housing, clothing, feeding, schooling, and medical side of things. If you're a dentist who likes surgical extractions and would like to learn how to do it in a simplified, systematic process and take away the stress element out of it, then this is the course for you.
Definitely recommend it, especially for someone who has minimal or no experience, because hands-on courses, there's not many of them out there, so I think it's definitely worthwhile doing. No regrets.